Bachelor of Science Nursing Microbiology, Unit 3, Pathogenic Organisms, Protozoan Parasites, Giardia intestinalis, Infection, Name Giardiasis, Intestinal Infection, Characteristics, Pear-shaped trophozoite with flagella for motility. Cyst form is hardy, resistant to environment, infectious stage. Source of infection: contaminated water, streams, lakes, unwashed fruits, vegetables, unclean food handlers. Portal of entry: oral ingestion of cysts. Transmission: fecal-oral route. Pathogenesis life cycle. Ingested cysts survive stomach acid, exist in small intestine, release trophozoites, attach to mucosal lining, interfere with nutrient absorption, cause malabsorption and diarrhea. Trophozoites may encyst again and be excreted. Signs and symptoms: watery diarrhea, greasy, foul-smelling stools, bloating, flatulence, abdominal cramps, weight loss, malabsorption, especially fat and fat-soluble vitamins. Lab diagnosis: stool examination for cysts or trophozoites, antigen detection tests, string test, entero test to sample duodenal fluid. Prophylaxis: drink purified water, maintain good hand hygiene, wash fruits, vegetables thoroughly, avoid untreated water sources. Trypanosoma species: T. brucei, African sleeping sickness, T. krusei, Chagas disease. Infection: name African trypanosomiasis, T. brucei, American trypanosomiasis or Chagas disease, T. krusei. Characteristics: flagellated protozoa with undulating membrane, visible in blood and tissue. Source of infection: tsetse fly, Glossina spp for T. brucei. Reduviid bug, kissing bug, feces for T. krusei. Portal of entry: skin through bite. Tsetse fly bite directly for T. brucei. Bite wound contamination with infected feces. Trypanosoma krusei. Transmission: vector-borne transmission via insect bites. Pathogenesis life cycle: T. brucei. Tsetse fly injects metacyclic trypomastigotes, multiply in blood and lymph, cross blood-brain barrier, CNS involvement, sleeping sickness. T. krusei. Reduviid bug defecates during blood meal. Metacyclic trypomastigotes enter host, invade cells, especially cardiac and GI tissues, cause myocarditis, megacolon. Signs and symptoms: T. brucei, fever, lymphadenopathy, sleep disturbances, neurologic deterioration, coma, late stage. T. krusei, acute fever, swelling at site of entry, chagoma, myocarditis, megaesophagus, megacolon, heart failure. Lab diagnosis: blood smear to visualize parasites, serological tests, antibody detection, PCR for DNA identification, prophylaxis, vector control, insecticides, traps. Use of bed nets, protective clothing, no effective vaccine, Leishmania species infection. Name Leishmaniasis, cutaneous, mucocutaneous or visceral Kala-Azar. Characteristics: intracellular amastigotes within macrophages. Promastigote form in sandfly vector. Source of infection: sandfly bite, phlebotomys species or Lutsamia species. Portal of entry: skin, site of sandfly bite. Transmission: vector-borne, bite of infected sandfly. Pathogenesis life cycle: sandfly injects promastigotes, phagocytosed by macrophages, transform into amastigotes, multiply inside macrophages, spread to various tissues, skin, mucosa, viscera, depending on species. Signs and symptoms: cutaneous leishmaniasis, skin ulcers at bite site. Mucocutaneous leishmaniasis, destruction of mucous membranes of nose, mouth. visceral leishmaniasis, Kala azar, fever, weight loss, hepatosplenomegaly, pancytopenia. Lab diagnosis, skin biopsy, bone marrow smear to find a mastigotes. RK39 antigen detection test, PCR for confirmation. Prophylaxis, avoid sandfly bites, insect repellents, protective clothing, insecticide-treated bed nets. Entamoeba histolytica infection, name, amoebiasis, amoebic dysentery, liver abscess. Characteristics, amoeba with pseudopodia, cyst and trophozoite stages. Source of infection, contaminated food and water, cysts. Portal of entry, oral ingestion, fecal-oral route. Transmission, fecal-oral. Pathogenesis life cycle. Ingested cysts exist in small intestine. Trophozoites move to colon, invade colon wall causing ulcers, may spread via bloodstream to liver, form abscesses. Signs and symptoms, bloody diarrhea, dysentery, abdominal pain, liver tenderness if liver abscess forms, fever. Lab diagnosis, stool microscopy for trophozoite cysts. Antigen detection in stool, imaging, ultrasound, CT for liver abscess. Prophylaxis, sanitation, clean water, thorough washing of fruits and vegetables. Plasmodium species, P. vivax, P. malariae, P. ovale, P. falciparum. Infection. Name, malaria. Characteristics, ring forms, trophozoites, schizons seen inside RBCs. Source of infection, bite from infected female Anopheles mosquito. Portal of entry, skin, mosquito bite. Transmission, vector-borne, mosquito. Pathogenesis life cycle. Mosquito injects sporozoites, travel to liver, infect hepatocytes, form schizons, rupture and release merozoites, infect RBCs. Cyclic RBC rupture causes symptoms. Some parasites differentiate into gametocytes, taken up by another mosquito. Signs and symptoms. Periodic. Fever every 48 to 72 hours depending on species. Chills, sweating, anemia, splenomegaly, cerebral malaria, severe falciparum cases. Lab diagnosis, peripheral blood smear, thick and thin smears. Rapid diagnostic tests, RDTs for Plasmodium antigens. PCR for species differentiation, prophylaxis, mosquito nets, insect repellents, insecticide spraying. Chemoprophylaxis with antimalarial drugs in endemic regions, e.g. atovaquone proguanil, doxycycline, mefloquine. Helminth Parasites, Ascaris lumbricoides infection, name Ascariasis, morphology, characteristics, a large cylindrical roundworm. Adults measure 15 to 35 centimeters, creamy white in color. Females are longer than males. Source of infection, contaminated soil or food, especially raw vegetables. Portal of entry, mouth, ingestion of embryonated eggs. Transmission, feco-oral route, through ingestion of water or food contaminated with Ascaris eggs. Pathogenesis, life cycle. Eggs are ingested, larvae hatch in small intestine, penetrate intestinal wall, enter bloodstream, reach lungs, migrate up trachea, swallowed again, return to intestines, mature into adult worms. Adult worms in the intestine cause mechanical obstruction, malnutrition, and hypersensitivity. Signs and symptoms, early Loeffler's syndrome, cough, wheezing, eosinophilia. Later, abdominal pain, intestinal obstruction, nausea, growth retardation in children. Lab diagnosis, stool examination for fertilized, unfertilized eggs, peripheral blood, eosinophilia, prophylaxis, proper sanitation, washing vegetables before eating. Periodic deworming in endemic areas. Ancylostoma duodenale, hookworm infection. Name, hookworm infection. Ankylostomiasis. Morphology, characteristics, small curved worm, 1 centimeter. Has cutting plates or hooks in the mouth for attachment to the intestinal wall. Source of infection, contaminated soil. Portal of entry, skin penetration, usually through bare feet. Transmission, larvae in soil penetrate the skin of people walking barefoot. Pathogenesis life cycle, larvae penetrate skin, reach lungs via bloodstream, enter alveoli, ascend to throat, swallowed, reach intestine, mature, feed on blood. Leads to iron deficiency anemia due to chronic blood loss. Signs and symptoms, itchy rash, ground itch. At site of entry, cough during lung migration. Abdominal pain, pallor, weakness, fatigue due to anemia. Lab diagnosis, stool examination for eggs. Occult blood in stool, eosinophilia in peripheral blood. Prophylaxis, wear shoes, improve sanitation and hygiene. Regular deworming in affected areas. Taenia species, T. solium, pork tapeworm, T. saginata, beef tapeworm. Infection, name, Taniasis, intestinal infection. Cystic urcosis, T. solium, larval tissue infection. Morphology, characteristics, flat segmented worm, 2 to 10 meters long. Scolex, head has hooks, Taenia solium or suckers, Taenia saginata. Source of infection, undercooked pork, Taenia solium or beef, Taenia saginata. Portal of entry, oral, ingestion of larvae in undercooked meat. Transmission, eating undercooked pork or beef containing larval cysts, cystic cursi. Ingestion of T. solium eggs can lead to cystic urcosis. Pathogenesis/life cycle. Cystic xerce ingested via meat develop into adult worms in intestine, produce eggs. Eggs released in feces infect livestock, complete the cycle. In cystic urcosis, humans ingest eggs. Larvae migrate to tissues, brain, eyes, muscles, form cysts. Signs and symptoms: teniasis, mild abdominal discomfort, weight loss. Cystic urcosis, neurological symptoms: seizures, hydrocephalus, eye problems. Lab diagnosis, stool exam, proglottids or eggs. Imaging, CT/MRI for cystic urcosis. Prophylaxis, properly cook pork beef. Avoid raw meat, maintain good hygiene and sanitation. Wuchereria Bancrofti infection, name, lymphatic filariasis. Elephantiasis, morphology, characteristics, thread-like filarial worm. Adults live in lymphatic vessels, microfilariae circulate in blood. Source of infection, mosquito vector, Culex, Anopheles, Aedes. Portal of entry, mosquito bite, injects larvae. Transmission, vector-borne, via infected mosquito bites. Pathogenesis, life cycle, mosquito bites human, injects larvae. Larvae travel to lymph nodes, mature into adults, cause blockage of lymphatic vessels, chronic inflammation, elephantiasis. Microfilariae circulate in nighttime peripheral blood. Signs and symptoms: fever, lymphangitis, swelling of limbs, scrotum, hydrocele. Chronic cases: elephantiasis, massive swelling due to lymphatic obstruction. Lab diagnosis: night blood smear to detect microfilariae. Antigen tests, more sensitive. Prophylaxis, mosquito control, nets, repellents, improve drainage. DEC tablets in endemic areas, mass drug administration.